Assalamu alaikum. Welcome back to my channel. In today's video, we are going to discuss talks. We will discuss what is talks. We will discuss how it is being taken. In the end, I will discuss very frequently asked questions related to talks. In today's video, I am going to discuss specifically about the family medicine MCPS talks. Okay, so let's start the video. Toacs is basically task-oriented assessment of clinical skills. This is the full form of Toacs, that is task-oriented assessment of clinical skills, which means that you are assigned a task and there will be some teacher or observer who is going to observe you and assess you based on your clinical skills or your knowledge or your history taking skills. In fact, all type of skills will be assessed in this exam. There are two types of stations in the TOEIC exam. One is observed or interactive type and the second is unobserved or static type of stations. As you all know this that whenever you give MCPS or FCPS exam, there are two parts of exam. One is written exam in which you are assessed through written exam and the second is clinical exam. The clinical exam is further consist of a variety of types. Like in FCPS, you give short case, long case, and talks. But here in the MCPS family medicine, the clinical exam consists of talks only. Talks consist of 12 to 20 stations. The time allowed is 4 to 8 minutes at each station and the total marks is for all the exam is 10 and passing marks is 6. Task oriented assessment of clinical skills will be held at all the centers for all the candidates who has cleared their written exam. The candidates will be evaluated on the procedures, x-rays, laboratory findings, instruments, specimens and patients. This component of examination will consist of, I have already told you that it is consisting of 12 to 20 stations. One or two maybe are rest station and the remaining are exam stations. Candidates will have to rotate through all of them in turn. At these stations, clear instructions would be written for the performance of a task. The candidate is expected to read the instruction and act accordingly. On unobserved or static station, the candidate will be present with a clinical case, laboratory data, X-ray, ultrasound, CT scan or instrument specimen etc. and will be asked to give the written response to the question asked in the station. In the observe or interactive station, the candidates will have to perform a procedure, for example, taking a history, performing clinical examination, counseling, breaking a bad news, assembling an instrument. One examiner will be present at each station at these observed or interactive station who will either rate the performance of the candidate or they may ask the question testing the reasoning and problem solving skills of the candidate. The performance of each candidate will be assessed by the examiners on a predetermined assessment form and the candidates will have to submit written responses to best answer or short answers in the response sheet. As I already mentioned that candidate will rotate through the station in this way till that they have completed the whole circuit. They will move only in one direction. There will be no repetition of the station. Candidates will be evaluated only on the basis of their performance on the TOEIC station. For passing, the candidate will be required to score 60% marks in the aggregate of all stations. No minimum score is required to be obtained at each station, which is a good point that you have to get marks or you have to pass the exam based on all the combined result, not individual scoring of each station. This is one of the good criteria. Now I would like to discuss some important and frequently asked questions which student has asked me below my videos in comments or they have asked me personally. First of all, people ask that is it free or there is a separate fee for it. When you clear your written exam, then after the result of your past exam, after like 3 to 4 months or maybe 2 months, you are asked to give talks. Toacs exam by the CPS and the Toacs is free for the first time. Remember it when you pass the written exam. Then the first time when CPSP call you for the Toacs, it will be free after your passing written exam. If you cannot pass it in the first go, then CPS will demand fees for your Toacs exam. So work hard in your first run and try to pass it in your first run. As far as I remember, you have three chances to clear your talks. If you cannot do it, unfortunately, or you have to sit in the written exam again. You can confirm this information from the CPSP. All the information I have given you up till now, they are all from the CPSP. So this is not a difficult thing. You can just go on the CPSP website, write down Toacs Family Medicine, and get all the latest information. Anyhow, I have to give answers about the frequently asked question because they are the main thing. So it will be huge stress for you if you cannot pass the exam in your first step. So it's better you try to work hard and pass it in the first term. And believe me, you can do it. It is not a big thing. It is not very difficult. If you are seeing patient regularly, you have studied, you have passed the written exam, just focus on the skills and examination and other history taking skills or instruments and go through them and start preparing 1 to 2 months before the talks and give the exam. You will pass it, inshallah. Next question, how to prepare for it. If you have joined the course for written preparation, they will definitely make you prepare for talks also. Don't worry. Like if you have joined the Dr. Nasisha course, or if you have joined some other course, or if you are doing training in a institute, they will also prepare you hopefully for the talks. Or you can ask your consultants to make you prepared for the exam. This is not a big deal because I believe that in my country, consultants are very cooperative and they love to teach their student. So if you like to learn, they will teach you. And if you pass your written by your own, you have not joined any training, you have not joined any course, then even then you don't need to worry. You can still join these talks preparation courses. They will give hands-on approaches, hands-on session, and you will prepare with them. You have to keep an eye on the news and the institutions whether or when they are offering such courses. Okay, so if you want to join such type of courses and you have given the exam through your own, then you need to be active and checking on their websites when they are offering such courses. And how is the exam? I have already told you. From my experience, I would like to tell you that different types of station are there. Some have some physical examination of a system, like a patient with the chest pain or like this, and you have to do CVS examination and relevant examination for that. A station can be of history taking, a station can be of counseling, a station can be with a picture and you have to ask further question from the patient, or you have to further examine the patient. A station can be of writing some prescription for a common problem. Station can be of breaking bad news. There could be some special test for a special problem like knee pain examination and its test. Similarly, some hearing test may be there. So you should focus on examination of all systems and further specific tests for common diseases like diagnosing appendicitis. These type of questions are asked in the exam. Similarly, history taking and differential diagnosis questions, these type of things are basically asked. Practice about counseling and breaking bad news, following ethics. If you cannot join such class for preparation, you should daily visit patients, spend time with patients, examining them and practicing them. Read some good books for examination, some authentic and updated books. You can do it if you have studied well for written exam. And one of the best advice I can give you is that you have to be in touch with the patient continuously. You should daily visit multiple patients. My focus is to seeing patients only. I hope you have gone through all your questions. If you want to ask further, you can just write down the comment. This is all the thing I have known for talks, and I have given information from the CPSP website and from my own experience. I hope you have understood a lot. If you still have some queries, you can just write down in the comment section. I will definitely answer them and help you. Take care. Remember me in your prayers. Take care. Allah Hafiz. Allah bless you. Ameen.